Aloha! Dr. Kepo'o here with a special video series on sleep apnea and snoring. I've been trying to do this video for quite a while now. We used to have a class on teaching you how to get rid of sleep apnea and snoring through 5 easy exercises, and I've had a big request to bring that class back, but I've been so busy I haven't been able to. So I thought it's time to bring a video up where I can teach you how to do these 5 exercises so that then you can have them at home and you can go over the video on any exercise that you didn't quite understand, and then you can go over the exercises and really learn how to do it and really apply it, because you've got to apply the exercises on a daily basis for this to work. So here it goes. So five exercises to stop your sleep apnea and to stop your snoring. Okay? All these exercises are trying to do is trying to strengthen all the muscles around here in your throat, okay, and your neck, and then the right here in your chin area. Okay? Also, they're designed to be able to take your trachea and pull it up closer, because what happens is your trachea starts to drop down as these muscles start to relax. It pulls your tongue back into your throat, which then can cause sleep apnea and also cause snoring. Okay? So the first exercise is called Buzz the Brain, and it's meant to warm up your sinuses to help get a lot of moisture inside your sinus cavity so that moisturized air can be able to flow through your cavity much easier. Okay? So what you do is that you just do a low hum. You do that hum for about 30 seconds, and that's going to stimulate your mucous membranes and be able to moisturize the air inside your sinus cavity. Okay? Exercise number 2 is called the tiger yawn, and all you're doing is you're yawning like a tiger. So you may need a mirror while you do this exercise, but all you're going to do is that you're just going to open your mouth wide open, and as you do that, you're going to stick your tongue way out like a tiger yawn. Now as you do that, you want to be able to lift the uvula, the little dangly thing in the back of your throat, up as high as you can. That's going to exercise all the muscles in the back of your throat. And that's all you do. And like I said, you may need a mirror because you need to know if you're lifting your uvula up high enough or not. Okay? But once you've got the feel of how to do it, you won't need the mirror. And then all you do is that you do 5-second holds 5 to 10 times. Okay? You want to start on the lower end when you first start to do it, because it is pretty exhausting doing these exercises. So like I said, open wide, lift up your uvula and stick out your tongue. Okay? Exercise number 3 is actually called the laughing hyena. And this one's a real funny one. All you're trying to do is you're trying to strengthen and turn on your diaphragm, which is the muscle that helps you with the expansion and depression of your lungs. And all you do is you laugh just like a hyena. And what that does is it gets your diaphragm going, and it strengthens your diaphragm so you have more power to be able to breathe at night, be able to get the air down into your lungs, the air out of your lungs. And you're going to laugh just like that for as long as you can for 30 seconds. And you want to do this with a partner because it's real funny. Okay? The exercise number 4 is called lick the ceiling. You do that, you try to lick the ceiling anyways. And what you're doing is that you're lifting up your head as high as you can and sticking your tongue up towards the ceiling as far as you can, like you're trying to lick the ceiling. What that does is you stick your tongue out as far as you can and lift your head, it starts to bring your trachea up. Okay? Starts to strengthen all those muscles that are around this area. Then that allows your tongue to stay in a neutral position instead of slipping back inside your throat and causing that snoring irritation or even the sleep apnea irritation, because the tongue is closing off your air passageway. Okay? And again, you're going to do 5 of those for 5 to 10 second holds. Okay? And that's all you do with that one. Okay? Last exercise is called Lick the Ceiling 2. Okay? And what you're trying to do is lick the ceiling again, but this is a big move. All these other exercises that you've done have actually warmed you up to this point. Okay? So what you do is you bring your chin down, stick your tongue way out, and then you're going to gently bite down on your tongue and lift your head up. When you get to the very top, while you keep your tongue sticking out, you're going to swallow. Okay? What that does is that swallowing really lifts up the trachea, really gets all the muscles just to contract and to get some tone in there, really lifts up that trachea out of the way, and you'll really feel how many muscles that actually works when you do that. And you're going to do that 5 to 10 times, okay? A little trick to be able to do that a little easier when you're first learning how to do it is that you want to collect a little spit in the back of your throat before you go down and lift up, so you have something to swallow on to be able to get used to that. Once you get those muscles toned and worked out, then you won't need the spit. You'll just know how to do it, okay? That's it. Those 5 exercises, all you need to do to be able to stop snoring and stop the obstructive sleep apnea that you may have. A little caution here and there is that if you do start having any neck pain, jaw pain, if it causes any type of extreme pain, anything like that, then stop doing the exercises right away and give me a call, so that maybe we can find out why it's painful. It should not be a painful exercise unless you've got anything complicating the process, and we'll want to look into deeper to find out why it's not working very well for you. Also, a couple other things. You want to make sure you do this every single day, or it's not going to work. You may even want to do it 2 or 3 times a day, okay? The best time to do it is right before you go to bed, because all those muscles are toned and tight before you go to bed. And you'll want to do them every single day for at least 2 to 4 weeks, okay? With any type of exercise, you really need to do it at least 4 to 6 weeks on a consistent basis to be able to really see any changes. So at least 2 to 4 weeks every single day that you're going to be doing these exercises. Then as things start to improve, as the snoring goes away, as the sleep apnea starts to improve, you won't have to do it as often. You may only need to do it every other day. You may only need to do it once a week. You'll just have to kind of experiment and ask whoever may be sleeping with you, ask whoever is there listening to when you're sleeping at night, to find out if you're still snoring, if you're still having the sleep apnea episodes after you've stopped doing the exercises on a consistent basis. And if you have any questions at all about any details about snoring or sleep apnea, then feel free to give me a call, and I can give you all the answers that you may need. So like I said, these are really easy exercises. Have a lot of fun with them, do them every single day, and you'll find that the sleep apnea and the snoring will just go right away. Well, good luck, and we'll see you again.